These are the things that most people are never told about before using their TruHearing hearing aid discount plan. Hey guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona, and in this video, I'm going to walk you through exactly how TruHearing works and some things to look out for so you're not disappointed with your hearing aids. Okay, so if you're watching this video, chances are you're looking into using TruHearing for the first time, or you've already used TruHearing and you're not getting the results that you were expecting. Either way, you're in the right place, because in this video, I'm talking about all the things that most individuals with TruHearing are never told about. To understand how TruHearing works, it first helps to understand what TruHearing is and why it exists. TruHearing is what we call a third-party administrator. Essentially, insurance plans will contract with a company like TruHearing to administer their hearing aid benefits. This includes Medicare Advantage plans, employer health plans, union health plans, and commercial insurance programs. TruHearing was founded back in 2003 to make hearing aids more accessible through insurance-based discounts. But in 2018, TruHearing was acquired by a company by the name of Sivantos, who was also the parent company of hearing aid manufacturers Rexton and Signia. And since Sivantos merged with hearing aid manufacturer Widex in 2019, TruHearing is now owned by WS Audiology, which is one of the larger conglomerates in the hearing aid industry. This means that TruHearing is now part of a vertically integrated hearing healthcare system. This means that they control everything from hearing aid manufacturing to lead generation to fitting and dispensing, and even, you guessed it, insurance benefit administration. Once you understand this about TruHearing, it makes it a lot easier to understand how their discount program works. So let's go ahead and break down everything that you need to know about TruHearing, but before I do me a huge favor, click the like button. It really helps out the channel, and if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It's greatly appreciated. And let me know if your insurance plan contracts with TruHearing to administer your hearing aid benefits down in the comment section. Okay, so the first thing that you really need to know about the TruHearing discount program is that they have two different programs. One is called TruHearing Select, and the other is called TruHearing Choice. TruHearing Select is the primary structure that you'll find in most Medicare Advantage plans. This plan is more restrictive when it comes to hearing aid selection. Basically, this plan only offers TruHearing branded hearing aids that are basically white labeled devices from Signia. And they come in three different technology levels. You have TruHearing Premium, TruHearing Advanced, and TruHearing Standard. As of this recording, these particular technology levels are very similar to the Signia iX7, iX5, and iX3 technology levels. There is also a distinction between the TruHearing devices and the TruHearing Plus devices. Essentially, the TruHearing Plus devices are the BCTIX line of devices from Signia. These hearing aids use Bluetooth Classic instead of Bluetooth Low Energy and Bluetooth LE Audio that gives you Auracast capabilities. They also have different style options for these technology levels. You have the Instant Fit Signia Silk style devices, but you also have custom in the ear in the form of IIC, CIC, half shell, and full shell, and then of course you also get access to receiver and canal technology. On the other hand, if your insurance plan gives you access to the TruHearing Choice program, then you have a lot more technology options available to you. The Choice program not only offers the TruHearing brand of hearing aids, but it also offers all of the other major manufacturer brands. This includes Signia, Widex, Resound, Starkey, Oticon, and Phonak. And it offers all of these other brands in different technology levels, rechargeable and non-rechargeable offerings if the brands have them, and you also get a variety of different style options. This brings me to the second thing that you need to know about TruHearing, which is the cost of the hearing aid technology as well as the cost of the professional services. The TruHearing Select program offers hearing aids at a lower price point compared to the TruHearing Choice program, but primarily because you are locked into only one particular brand of hearing aids that are white labeled. Generally speaking, under the Select program, you can get TruHearing Premium hearing aids for around $2,000 for a pair. If you go with the TruHearing Advanced devices, you can get those for around $1,400 for a pair. And if you elect to go with the TruHearing Standard devices, you can get a pair of those for only $800 a pair. However, I should mention that there is also an upcharge for these hearing aids if you choose to go with the rechargeable version of them. Now, if you have the Choice program, the cost of these hearing aids will range anywhere from $4,500 for a pair down to $1,600 for a pair. TruHearing typically gives you a 60-day trial period with your hearing aids, and if you're not having success with your hearing aids, you can return those hearing aids for a refund within that time period. Their hearing aids also come with a 3-year warranty from the manufacturer. You also have access to different wireless accessories through TruHearing, which includes TV connectors, remote controls, and remote microphones that'll cost you anywhere from a couple $100s up to a couple $1,000s. If you do elect to go with disposable battery versions of their hearing aids, they will provide you with 80 batteries per hearing aid. I should mention that when you're purchasing hearing aids through TruHearing, you're not actually paying your provider's clinic. You're actually paying TruHearing directly. Your provider just goes into the TruHearing portal, submits your payment, and that gets everything rolling. You actually make this payment upon ordering your hearing aids, presumably at your consultation appointment. It is also possible that you may have a funded benefit through your insurance plan or through your state. This is when a portion or all of your responsibility to pay for your hearing aids is picked up by your state, your employer, or your insurance plan. In my experience, it's more common for people to have unfunded benefits rather than funded benefits. Of course, that's not all bad because some funded benefits restrict your access to different hearing aids and different technology levels. It's worth mentioning that if you have access to the TruHearing Select program, but you'd rather have devices from the TruHearing Choice program, you can opt out of the Select and just pay out of pocket for whatever is in the Choice program. As far as the service fees are concerned, your initial hearing test will cost you usually anywhere between $0 and around $45. This usually depends on what insurance plan you have. Now, all services rendered by your hearing care professional over the course of the first year are all included in your hearing aid purchase. Other than that though, all services that are rendered by the clinic that dispensed you your hearing aids through either one of these TruHearing programs are responsible for providing you with free services over the course of your first year of care. And after your first year, your clinic is required to charge you no more than $65 per office visit for any services that you receive from them. The exception to this is if you lose your hearing aids, you can be assessed up to a $125 replacement fee and an additional fee from the hearing aid manufacturer through the clinic. And all of this information should be provided to you in writing by your provider at your TruHearing participating clinic. All right, the third thing that you need to know about TruHearing is how your provider and their clinic actually gets paid. Here's how it all actually works. First, when you purchase hearing aids through the TruHearing program, the money goes directly to TruHearing, not the provider's clinic. Next, TruHearing uses a portion of that money to purchase the hearing aids from a manufacturer. The manufacturer then ships those hearing aids directly to the provider's office. The provider fits and programs the hearing aids and provides any follow-up care included under the TruHearing agreement during the first year. After the 60-day trial period is complete, TruHearing pays the provider a small fitting fee, the specifics of which I'll cover here in just a minute. After the first year, any service fees charged by the provider go directly to the provider and no longer flow through TruHearing. But that's not the end of the story. In addition to retaining a portion of your hearing aid payment, TruHearing also receives compensation from the insurance companies for administering these hearing aid benefits. So if you follow the money, you'll see that TruHearing functions as an administrative middleman between the patient, the insurance company, the manufacturer, and the provider. That's very different from a traditional insurance model where the provider delivers the care, bills the insurance company directly, and receives payment directly from the insurance company. Since your hearing aid payment goes directly to TruHearing and not to the clinic that you go to, TruHearing will actually pay the clinic what is known as a provider fee. As far as how much your provider gets paid, if you're on the TruHearing Select program, the provider fee will range between $250 per device if they dispense a standard level technology tier, up to $400 per device if they dispense a premium level technology tier. If you're on the Choice program, the provider fee can be up to $600 per device if your provider recommends premium technology from TruHearing, Signia, or Widex. However, this provider fee can drop down all the way to $400 per device if they fit a lower technology level from a different hearing aid brand. After your first year of care, TruHearing providers are only allowed to charge you up to $65 per visit. Okay, so by now you should have a pretty good understanding of how TruHearing works when it comes to their discount hearing aid program, but let's dig a little bit deeper to find out what this actually means for you as someone with hearing loss who wants to use your discount. And this next part is where things start to get really important, because the fourth thing that you need to know about TruHearing is that the quality of care that you receive can vary widely between different TruHearing providers. It's important to understand that a discount hearing aid program like TruHearing does not guarantee satisfactory outcomes with their hearing aids. A discount program is intended to give you access to hearing aids at a lower price price point and to limit the exposure of insurance companies to the cost of hearing treatment. TruHearing does not mandate that hearing care professionals inside of their network provide you with the minimum standard of care that have been outlined by the Audiology Practice Standards Organization, nor do they mandate that professionals have to provide best practice audiologic care as outlined by the guidelines of American Academy of Audiology, American Speech Language Hearing Association, or the International Hearing Society. And this matters a lot because the quality of care that you receive from your hearing care professional will completely dictate how much benefit you get from these hearing aids. Some of these high quality best practice standards of care that I'm talking about include speech and noise testing, which is used to identify how much separation you need between speech and background noise to be able to understand someone in a noisy environment, test box measures to ensure that your hearing aids are meeting manufacturer specifications and actually mechanically functioning properly, real ear measurement to verify that your hearing aids are programmed precisely to your hearing loss prescription to maximize your speech understanding in quiet and noisy environments, and validation outcome measures to ensure that you're receiving significant improvement in your hearing aid communication ability for a variety of different listening situations that are important to you. And these are only 4 of many best practices that exist in order to get you an optimal treatment outcome with hearing aids. Now, if you want a comprehensive checklist of all of the different best practices that your hearing care professional should be following, I will put a link in the description so you can print them off, take them into your hearing care professional, and hold their feet to the fire and make sure that they do them. Because the disbursement of the provider fee from TruHearing to your hearing aid clinic depends on if you kept the hearing aids past your trial period, not if you're actually having success with your hearing aids. In fact, there are cases where TruHearing actively discourages the use of best practices. I personally know a provider that was removed from TruHearing's program because they were charging for best practice services that were not covered under the discount program. And given that the provider fees are significantly lower than what clinics would receive from traditional insurance plans or private pay patients, it's really difficult for TruHearing providers to provide best practice audiologic care to their patients at a fraction of the cost. You guys know that I believe we are ethically required to provide best practice audiologic care to all of our patients, and anything less than that is completely unacceptable. But in the case of TruHearing providers, I can kind of understand why many of them don't provide best practices. Unfortunately, this is a natural byproduct of insurance companies and third-party administrators dictating your quality of care. Just know that when hearing care is not done correctly, it oftentimes leads to hearing aids being in your drawer rather than in your ears, which means that you'll have continued difficulty understanding speech, primarily from soft talkers, females, and in background noise situations. And of course, you'll have continued increased risk of accelerated cognitive decline, which could potentially lead to dementia down the road due to poor treatment outcomes. And probably why hearing aid satisfaction rates have become stagnant over the past several years, despite the fact that hearing aid technology continues to get better, and declining patient satisfaction rates in their hearing care professionals over the past 10 years. It's getting pretty sad out there. I've personally seen patients who've spent thousands of dollars going through their hearing aid discount program only to end up with hearing aids that are not really right for them, and a hearing care professional who didn't follow any best practice procedures to ensure that they'd actually have any treatment success. Which actually leads me into the 5th thing that you need to know about TruHearing, which is the amount of influence they can actually have on your overall treatment outcome. When you have a third-party administrator like TruHearing that is owned by a company that also owns other hearing aid manufacturers, you have to have an understanding of how that could potentially impact your hearing treatment. Now, it is entirely possible that your hearing care professional would have recommended the exact same hearing aids to you regardless of whether or not you're on a TruHearing program or you were paying privately. However, these reimbursement structures and technology limitations could potentially influence your hearing care professional to make a recommendation to you that isn't necessarily in your best interest. Just look at how the provider fees are higher if your hearing care professional recommends the TruHearing brand, the Signia brand, or the Widex brand that are all brands owned by WS Audiology, that also owns TruHearing. Now, you might think that an extra $100 or so wouldn't influence a hearing care professional's recommendation to you, but you have to remember that a lot of these TruHearing in-network providers do hundreds or thousands of different TruHearing fittings every single year. Whether or not these relationships directly influence clinical recommendations probably varies from provider to provider, but I do believe that you deserve transparency for how these programs are structured. Also consider that the TruHearing Select program program only offers TruHearing branded hearing aids. Chances are, if you're on this plan, you're getting TruHearing brand hearing aids regardless of whether or not those are actually the right hearing aids for you. Chances are you'll probably be okay with it because research tells us that when you have an insurance discount or insurance benefit, that you feel compelled to use it even if that recommendation is not the best for you. But this is different than how it used to work in the past. Before these third parties started hitting the scenes and start contracting with different insurance companies, a lot of insurance companies actually had in and out of network hearing aid benefits for their members. This means that your hearing care professional could recommend whatever hearing aids they actually felt was best for you. And they could actually bill the insurance company for best practice procedures to ensure that you had an optimal treatment outcome. And you did not even have to go to an in-network provider. A lot of these traditional insurance plans had out-of-network benefits as well, so you could go to any provider that you want to and use some form of benefit with them. However, this was also significantly more expensive for these insurance companies to administer, which is exactly why they do this contracting with third-party administrators like TruHearing. Now, in order to use your TruHearing discount, you have to go to an in-network provider with TruHearing. In fact, there are some insurances out there that had previously contracted on an in-network basis with different hearing care professionals that are now forcing these professionals to go with TruHearing in their clinics. And you know what? A lot of them aren't doing it, which is limiting your access to high-quality hearing care professionals. But as long as you're aware of these things, you can decide whether or not using your TruHearing discount is right for you. That being said, if your top priority is to get hearing aids at the lowest price possible, then using your TruHearing discount makes a lot of sense. However, if your top priority is to ensure that you can hear your absolute best by getting the best hearing aids based on your hearing loss, wants, and needs, and having those hearing aids fit and programmed by a hearing care professional who follows comprehensive audiologic best practices, then you may have to make the difficult decision to forego your TruHearing discount program and find a hearing care professional who is not going to be influenced by your insurance or by a third-party administrator. And there you go. If you made it to this point in the video, then you have a better understanding of how TruHearing works than 99% of individuals with a TruHearing discount plan. But I want to hear from you. Do you feel like you have a better understanding of how TruHearing works after watching this? Let me know down in the comment section, and I'll see you in the next video.